All right. Hello, everyone, and welcome to the 2012 World Dairy Expo. Today's seminar is Avoiding Drug Residues in the Dairy Industry. Our speaker today is Dr. Jeff Smith, Associate Professor at the North Carolina State University College of Veterinary Medicine. Dr. Smith is an Associate Professor of Ruminant Medicine at the North Carolina State University College of Veterinary Medicine. Over the past decade, his research has been primarily on ruminant medicine with focus on calf health and drug use in cattle. He is also a contributing columnist to Horde's Dairyman magazine and has been featured in their monthly webinar series. This seminar has been approved for continuing education credits from the American Registry of Professional Animal Scientists and the American Association of Veterinary State Boards RACE program. Forms are available in the back if you are interested in those credits. I would like to now ask everyone to please silence your cell phones and welcome Dr. Jeff Smith.
Okay. Well, I'd like to thank everybody for coming this morning. I'd like to thank Neogen for sponsoring this seminar. I'm going to talk about avoiding the residues in the dairy industry. Let me cut this off since I got a lavalier microphone on. This is not particularly a fun topic. It's not a sexy topic. I'm going to tell you to do some things that you're probably not doing. I might tell you to stop doing some things that you probably are doing. But I think this is a very important topic. I think avoiding drug residues, learning how to use drugs properly on your farm is very important for a number of reasons, which we'll talk about. So the goals of this seminar, I want to review responsible drug use on dairy farms, talk about some of the reasons why responsible drug use is important, understand how to use antibiotics legally and effectively in your herds. We're going to talk about the residue testing program in this country, make sure you have a basic understanding of that. And then most of the time we're going to spend on making sure you know how to avoid having a residue problem both in milk and meat. Okay. Now, I'm not here to tell you not to use antibiotics on your farm. I think this is an animal welfare issue. Cows get sick. We definitely need to use drugs. But we need to make sure we're using them responsibly for a couple of reasons. Probably the most important is to make sure that the cows are going to respond to therapy. If you have a cow with mastitis, if you have a cow with pneumonia, you need to make sure you're using the appropriate drug for that disease. Okay? And that comes from working with your veterinarians. Second reason for responsible antibiotic use is to make sure we don't have residue violations. That can have a very negative economic consequence or impact for your herd. We want to try to minimize the development of antimicrobial resistance by making sure we're using the appropriate drug or appropriate antibiotic for the appropriate disease. And lastly, responsible use of antibiotics helps to make sure that our cows on our farm are healthy and productive. Okay, we need to remember that we're producing healthy products. Okay, we're producing two different products, milk and meat. And the perception of the public of these products is very important to our industry. Even if we have one residue out of 100,000, if it causes a fatal reaction or a very severe reaction, winds up on the front page of the New York Times, that could have a very detrimental impact on our industry. Okay, so think about these images as you're selling a cull cow. Is that something that you would want your children to eat when you're milking that milk into the bulk tank? Okay? Public perception of our industry is very important. This is some data from the National Animal Health Monitoring Survey. This is done by the USDA every 5 to 10 years. These are some data on the reasons why we use antibiotics in the dairy industry. By far the #1 reason is mastitis. So this is the 2002 survey and the 2007, which is the most recent survey. Percentage of cows on dairies treated with antibiotics during the past year. So 15 to 16% of each cow during a 1-year period is treated for mastitis. About 7% of cows are treated for lameness. That would be both foot rot and hairy heel warts or digital dermatitis. About 5 to 10% are treated for reproductive disorders, primarily metritis. And then the rest of these sort of drop down, pneumonia, diarrhea, and other. Percentage of dairies that use antibiotics for specific diseases, almost all dairies, 85% for mastitis. About half use antibiotics for lameness, reproductive diseases, pneumonia, and so on. Okay, so those are the main reasons we use antibiotics in the dairy industry. I want to spend a couple minutes talking about different categories or classes of antibiotic use. Okay, there is approved antibiotic use. That is using a specific drug that is approved for use in adult lactating dairy cows at a specific dose for a specific disease given by a specific route. Okay, so examples of that would be if you're giving long-acting oxytetracycline for foot rot. That drug is approved for treating interdigital dermatitis, foot rot at a given dose, a given route of administration. If you're using Exenel, okay, which is ceftiofur for metritis, Polyflex, which is ampicillin for pneumonia. These are all examples of approved antibiotic use. Okay, extra label antibiotic use. So most of you, if you're involved in the dairy industry, are using extra label antibiotic use on at least some occasions, and most people don't realize this. Okay, so this is using a drug in any species not listed on the label. So if you're using a beef cow drug like, say, Nuflor in an adult dairy cow, that now is extra label drug use. If you're using it for a different indication, so a different disease that's not printed on the label, if you're using a different dose than it says on the label, if you're given the drug by a different route of administration than it says on the label, any of that would constitute extra label drug use. Okay? Examples, if I'm given Banamine in the muscle, in the neck, instead of IV, that's now extra label drug use. If I'm given penicillin at a dose of more than 15 mils a cow, so it's labeled at 1 mil per 100 pounds. Almost nobody's using that dose. Most people are using 50, 60, sometimes 100 mils per cow. So that's not illegal, but that's extra label drug use. Okay? If you use a Nuflor, Micotil for your adult dairy cow pneumonians, that's extra label drug use. If you're giving Naxel to calves with diarrhea, a lot of people are, or cows with metritis. I said Exenel was legal, that's approved. Naxel is technically not approved for metritis. That's now extra label drug use, okay? Most of your intramammaries, like today, if you're using that for more than 2 milkings, that becomes extra label drug use, okay? If you're sedating a cow with xylazine, or your veterinarian is before surgery, none of the sedatives that we use are approved actually in cattle. That's extra label drug use, and we'll talk about the consequences or what that means here in a minute. Then we have illegal or prohibited antibiotic use. So there's certain drugs that are on the prohibited drug list published by the FDA, the Food and Drug Administration, that are not to be used in dairy cattle. So using any of these drugs would be illegal. Also using extra label drugs without sort of the oversight or permission of a veterinarian is not technically legal. The last thing that's very important to emphasize is any use of homemade or compounded drugs. Hopefully nobody's still using homemade intramammary formulations or anything like that. I've seen them out there, but that is about as illegal as we can get in the industry anymore. Okay? So examples of illegal drug use that you might see from time to time. Giving Baytril to an adult dairy cow. That's a fluoroquinolone. That is an illegal use of that drug. Okay. Within the last 6 months, there's been a ban on the extra label use of cephalosporins, which is primarily ceftiofur. So if you're using Spectramass twice a day, that in the last 6 months, that's gone from an extra label drug use to now that would be an illegal drug use. Okay. The label says you have to give it once a day. We have to stick with that now. Or if you're giving a drug like Exenel at twice the dose or a much higher dose, we can still use it for different diseases than it says on the label, but we can't change the dose or the route of administration. If you're using homemade intramammary mastitis products, if you're using a phenylbutazone or something like that, nitrofurazone sprays, those are just examples of things that would be considered illegal on a dairy farm. Okay. Keys to responsible drug use. The most important thing you can do to try to avoid a residue is establish a good relationship with a veterinarian. Okay? Several of the other things I'm going to talk about, like having treatment protocols in your herd, or based around having a good relationship with your veterinarian. Several studies have been done and published in the last 15 years that show pretty much every time that the #1 or #2 cause of residue violation is not having a good veterinary client-patient relationship. So not just because I am a veterinarian, but I think this is one of the things that we really need to do in the dairy industry is make sure we're working with a veterinarian. It doesn't have to be every week, but it needs to be on a regular basis, okay? If you are using extra label drug use, so if you're using more than 15 mils of penicillin per cow, if you're doing any of the things that we talked about on that other slide, this would be a requirement, okay? In order to do this legally, you have to have permission from a veterinarian or a relationship with a veterinarian to do this. So there's some very specific wording in the FDA code on what constitutes a valid veterinary client-patient relationship. And I want to go through this just for a second because this has been a problem down in my part of the country, and I just want to make sure everybody understands this. So in order to legally have a proper veterinary client-patient relationship in the United States, that means the veterinarian has assumed responsibility for making clinical judgments for animals on your farm, okay? You have agreed to follow his recommendations. So he has sufficient knowledge of the diseases on your farm to form a preliminary diagnosis and recommend treatments. So he's recently seen, he's been to your herd, he's aware of your diseases. Again, it doesn't mean he has to be there every day, but he should be there on a somewhat regular basis. They don't define this specifically, but in the dairy industry, the FDA will say roughly at least 2 to 3 times a year in the dairy industry, at least once a year in the beef industry, okay? Maybe much more frequent than that, but it should not be less than that. Veterinarians should be readily available or has arranged for some sort of emergency coverage for follow-up. So if you give a drug, particularly an extra label drug, and it's not working or the animal has an adverse reaction, that veterinarian should be able to show up at your farm and follow up within a 24-hour period. So if the guy writing your prescriptions is 3 states away, you do not have a valid veterinary client-patient relationship, in my opinion. Again, they don't have to be there every day, but they should be somewhat local, okay? They should not be in Texas if you live in Wisconsin. They should review your drug use protocols on a regular basis, and they should be available. You should get some service from your veterinarian that you're using to write your prescriptions or sell you drugs. They shouldn't be just somebody you call when you're out of Polyflex and need more, okay? Second thing, be sure your employees know how to properly administer drugs. Very few treatments on farms are given by veterinarians. Very few treatments are even given by the farm managers or the herdsmen. Most of our treatments are administered by lay farm personnel now. There's several different approved routes of drug administration, including oral, subcutaneous, intramuscular, intravenous, intramammary. We need to make sure all employees that might administer medication on a farm are trained to do this. There can be very significant changes in the withdrawal time if you give a drug by an improper route of administration. For example, if you happen to give Banamide sub-Q instead of intravenous, the withdrawal time, both milk and meat, changes considerably. So making sure your employees know how to administer a treatment properly is very important. Set up written protocols for treating common diseases. This is another important thing for avoiding residues, also for making sure your drugs are working most of the time. And this is where your relationship with your veterinarian comes in. There are many different employees that are in the sort of that chain of command in terms of treating diseases. We need to make sure that we're all doing the same thing, whether it's the morning milker, the afternoon milker, the night milker. If you have a case of mastitis, we want our treatment to be very consistent. We want everybody to understand what needs to be done when that disease happens. Setting up written protocols for herds will increase the chance that that happens on a regular basis. Will maximize the likelihood that the correct drug is used. Make sure your employees understand how to follow the protocol. So it may need to be in Spanish. It may need to be very simply written. I like to set these up as flow charts with things that are very easy for people to follow. Okay, so I don't know if y'all can see this, but this is not the protocol you need to use in your herd for diarrhea. This just gives you an example of how these can be set up. So this says calf with diarrhea. Is he standing with a suckle reflex? Is he not standing with a suckle reflex? This calf is standing. He has a fever greater than 103. We're going to give him 2 quarts of hydrolyte, which happens to be an oral electrolyte solution. they were giving them Naxel in the muscle, they were giving them Banamine, and they were calling the vet. So generally, I like to use product names and not oral electrolyte solution or Ceftiofur. People can go to the pharmacy, they can see what Naxel is, they can figure that out. Fever less than 103. And again, if you work with your veterinarian, they'll set up when they wish to be called. You may have herds where you give your own fluids and the vet may set that up accordingly. But try to, at least for the major diseases that we talked about on that first slide, the reasons why we're using antibiotics most of the time: mastitis, metritis, lameness, calf diarrhea. We want to have written protocols set up for most of those main diseases so we make sure that, one, we're using the correct drug and the cows are responding to therapy, and two, we're doing it the right way every time and minimizing our chance of having a residue violation. Okay? The downside is not many people are doing this. Okay? There was a survey out of Washington State a few years ago. Only 25% of dairy farms had written protocols set up. Another survey in Pennsylvania found about 20% of farms had protocols, and only actually about a third of dairies were seeking veterinary advice on any kind of regular basis prior to treating sick cows. So this is something we could be doing a much better job with in the dairy industry. Okay? I want to introduce you to Hector and Gonzalo. These are guys on a large dairy that I go to occasionally. They're very good with cows. They're not veterinarians. They are in charge of the sick pen. Okay, so you can see their box. If you turn the lights down maybe a little bit, you can see, but this whole compartment is full of bottles of antibiotics. This compartment over here is also full of bottles of antibiotics. Some of these are legal, some of these are not legal. Okay, so these guys are very good with cows, but they certainly are not following any type of specific treatment protocol. Sometimes they're basically giving what they think works that day. Again, they're good with cows. This farm has had a couple residue violations, has been on the repeat violator list, and their biggest problem is they're not working closely with a veterinarian. They're depending on two non-veterinarians to make most of the treatment decisions on the farm. And these cows do a very good job. These guys do a very good job, but they have no concept of what is an illegal antibiotic. They have no concept of what extra label drug use is. They don't understand how to prolong a withdrawal time if they increase the dose of a drug. And unfortunately, this scenario happens more and more commonly in the dairy industry. Okay? We need to maintain good treatment records. The FDA requires that dairies maintain drug treatment records for 2 years. They don't do it very often, but they could potentially come to your herd and say, you need to account for all drug sales within the last 2 years. Show us where those drugs have gone, into what animals, or how have you disposed of them. Again, they usually will only do that if they're following up a residue problem, but that should be something that you're prepared to deal with if it were to happen. Treatment records need to contain the cow number, the date the treatment was administered, the type of drug, the route of administration, obviously the animal that the drug was given to, who gave the drug, and the withdrawal period. So a chart like this, these don't have to be complicated. This can be a chart on the clipboard in the milk parlor, a spiral notebook on a small dairy, but there needs to be some treatment record. Okay? In a minute we're going to talk about marking or identifying cows that get treated, which a lot of people do, but remember, leg bands can fall off. The only way you have a permanent treatment record is actually having something written down that you can look back to and say, cow 5543 got new floor, we can't sell her this week. Okay? So this is very important. Again, this is just a sample treatment record. Cow, the date, time, if it was a mastitis treatment, what quarter it was, treatment, the dose, who gave it. Again, you know, this seems like common sense, but last time there was a survey done in Pennsylvania, only about half the dairies were writing this down. Only about half the dairies could produce any kind of treatment record when they were asked. Another study done in New York State about 10 years ago, they found the #1 reason for drug residue violations was not having treatment records. Okay? The number two most common cause in that survey for residues was poor relationship between the producer and the veterinarian. Storing drugs, antibiotics in a proper place, need to make sure that particularly with extra label drugs. Obviously, illegal drugs. There could be some drugs on your farm that would be illegal to use in cows that might be appropriate for use in calves. For example, Batril is approved for dairy calf pneumonia but would be illegal to use in cows. If you have any drugs like this, certainly keep them in a separate place from your over-the-counter or your approved products or your lactating cow intermammary tubes. Maybe your dry cow products should be kept in a different cabinet as well. Minimize the possibility that these drugs could be grabbed by accident, or somebody, you know, maybe they give Batril and they say that worked really well, and then they start using it on a regular basis and they don't realize that this is an illegal use of that drug. So if we have drugs like that on a farm, I prefer to see them locked up or at least kept at a place where only the manager or herdsman would have access to them. Okay. For example, this is a farm, this is our university dairy. They have different cabinets for lactating and non-lactating drugs. This would be sort of a bare minimum of what I would recommend in terms of keeping drugs in a safe place where people can't accidentally pick them up. Identify treated cattle. This can be done with leg bands, neck bands, colored chalk, but pretty much all of these are temporary. Okay, leg bands can fall off, chalk can come off in the rain. Neck bands are pretty good, but even they can come off once in a while when they get old. The only way you can permanently have a record of what cows were treated is to have it written down. But leg bands work really good as a backup system, or neck bands. People see these in the milk parlor. Uh-oh, she's got a red leg band. She's not supposed to be in this group. She should be a dump cow. And hopefully they go and check on her and see, can I milk her into the tank or not? Okay, so a lot of dairies will have many different color bands to signify different things, but use some system to identify cows that aren't supposed to be milked, cows that cannot yet be shipped to slaughter, and make sure all your employees know what these bands mean. Practice healthy herd management. So the most common way to avoid residues is to not use so many antibiotics. The most common way not to use so many antibiotics is to make sure you have a good herd management program in place. Make sure your housing, your sanitation, your nutrition is very good. Okay? If you're treating more than 25% of your cows as a general rule for a specific disease, that's too much. More than 25% of the cows are getting metritis. More than 25% of the calves have diarrhea. We need to work with a veterinarian to try to reduce that, okay, instead of just using antibiotics over and over and over again. Having a proper vaccination program in place is critical. Hoof care, okay, those are major reasons we're using antibiotics. If we can have prevention programs in place, we can reduce the number of treatments ultimately we're going to have to give and lower our chances of having a drug residue. So drug prevention or disease prevention is often more effective than treatment, and our goal should be to reduce the number of antibiotic treatments we need to give on a dairy. Okay? Have a good milk quality program. Remember, mastitis was by far the #1 reason we were using antibiotics. If we can reduce our risk of mastitis, we can reduce the use of antibiotics for the #1 disease. Use drug screening tests. Okay, there's a variety of on-farm tests available in this industry. Beta-Star Plus is sold by Neogen. There are several others that are out there, particularly following extra label drug use. Okay, so if you use 100 mils of penicillin for 5 days, you can be sure that penicillin is the one drug that's going to be tested for every time a cow goes to market or milk goes to market. It would be very smart to use an extra label or some kind of on-farm screening test, to make sure that cow does not still have a residue. There's been a study published showing that using these screening tests has been associated with a significant reduction in residues. So this, if you're not using them, this would be a good thing to incorporate on your farm. Okay? And lastly, consider culling non-responsive cows. So cows with unresolving disease that are at highest risk of residue violations, if you've treated that cow with 6 or 7 different antibiotics, maybe that's not a cow we need to cull. Maybe that's a cow that needs to be euthanized humanely on the farm. If you have a cow that you think is very unlikely to respond to treatment, maybe that's a cow we should cull right away and try to salvage her and get some money out of her instead of treating her with a bunch of different antibiotics. Okay? We have a lot of meat violations, cold cow violations in the dairy industry. And this is part of the reason why, is because dairy producers are very, very reluctant to give up on a cow. We will treat them very extensively, and then after they've had all these antibiotics and they're still not responding, well, let's get rid of them, okay? You know, maybe we make the decision we're going to really try on her, and if it doesn't work, we're going to euthanize her on the farm, or up front, this is just not a cow that's worth putting a lot of time and money into her, let's get rid of her from the start. So again, we don't make that decision on every case, but sometimes I think we need to think about this a little bit more than we do now. Complete quality assurance training. This is recommended for all farms. It's only mandatory for farms that have actually had a residue violation, but there is a manual that I'll show you in the next slide that will help you go through. There is a dairy quality assurance program set up in this country. You go through it with a veterinarian. He's going to review your health program in your farm, your drug use on your farm, and sort of give you some tips about where you could improve. Herds that have had a residue problem really need to do this quality assurance training, and again, sometimes the FDA will make this mandatory. This website, you can't see it very well down here. Let me see if I can pull this thing down. It says nationaldairyfarm.com residue_prevention. This whole manual you can download from this website. If you ask me at the end, I'll come back and we can get this written down. But this is a very good resource for producers and veterinarians alike. I would encourage you, if you're not familiar with this book, to go download it and at least read through it. It's got tables in there on approved drugs and what their withdrawal times would be, approved for use in dairy cows. It's also got tables that will tell you what milk screening tests you need to use. Let's say I gave ampicillin or Micotil to a cow. I don't really know what the withdrawal time is. My vet has told me, but I want to make sure she's clean. It'll tell you what cow side tests you can use. So there's lots of useful information in this book other than just sort of the dairy quality management program, but it'll take you through some of the same 10-step system on avoiding residues that I've been talking about already. Very good read for producers. Okay, residue testing. There's a lot of pressure from the consumers, from public health groups like CDC, to limit the use of antibiotics in food animals. CDC would be happy if we banned all antimicrobial use in food animals. There's also some consumer demand for organic or antibiotic-free meat, milk. I see a lot of people in grocery stores buy organic milk, and I'll ask them, why are you buying organic milk? And usually they tell me they feel it's a better quality product, or they feel the animals are treated more humanely on organic farms. I don't have anything against organic dairying, but I'm not sure either of those two statements is true. But certainly from a consumer perception standpoint, the dairy industry needs to minimize the risk of drug residues. Okay? People are seeking out antibiotic-free meat and milk. Milk is one of the most heavily regulated products in the world, and it needs to be really to protect consumers who might have allergies. Antibiotic residues could potentially interfere with manufacturing of some milk products like cheese or yogurt. And there is a federal act that assigns the food industry with the responsibility of ensuring the safety of milk. One of the reasons that we're probably more concerned about residues than we have been in a long time is because the government's ability to find them, very, very small concentrations of drugs in both meat and milk, has improved tremendously in the recent years. Okay? Whereas before maybe they could find 5 parts per million, now we're talking about parts per billion for most of these drugs. Okay? They're able to find drugs at a lot lower concentration than they ever have been before. Some of the drugs have tolerances, so they have concentrations that are allowed or legal in tissues, but some drugs don't have tolerances, particularly if you're using them in an extra label manner. Any drug that doesn't have a tolerance, any residue they find is considered a violation. Okay? So if they find it even at 0.5 parts per billion, down to the lower limit of their assay, that's going to be a violation for your herd. The FDA is under increasing pressure to do more and more testing. Currently in the United States right now, every bulk tank is tested for beta-lactam antibiotics. That would be penicillin, that would be ampicillin, that would be ceftiofur, drugs like that. and then they're randomly tested for other antibiotics. Okay? So this is data from the National Milk Drug Residue Database on a yearly basis through 2010. This shows you how many samples were processed or tested for antibiotics in a year. This is pretty much every tanker of milk is tested for beta-lactams. The number of tanks that have a positive residue violation, and you can see we don't vary that much. We're somewhere around 0.5, 0.4%. It stays about the same. Okay? By far, the number one cause of residue violations is beta-lactam antibiotics, but what you will notice is that is by far the most common antibiotic residue that is tested for. Okay? Between 03 and 06, 17 million tests done for beta-lactams, 12,000 residues. Between 2007 and 2010, over 15 million tests for beta-lactams, over almost 6,000 residues. So I say they randomly test for other drugs, sulfonamides, aminoglycosides, but when we say randomly, you can see 17 million to 250,000. There's a much lower rate of testing for those other drugs right now in this country. Okay. Cull cows. If we look at the poultry industry, the swine industry, the cattle industry, the dairy industry is responsible for about 90% of the residue problems in meat. Okay? And that's between cull dairy cows and veal calves. But the FDA sees the dairy industry as a major problem, as the major problem when it comes to residues. Okay? Carcasses get sampled randomly at slaughter. So randomly generated sampling, this is done by the meat inspector, is responsible for probably less than 5% of the testing. Most of the testing that gets reported is what they call inspector generated. So this is based on a couple different things, but ultimately it's based on suspicion of that inspector that there might be a residue in that carcass. So maybe he sees a lesion, maybe he sees an ejection site bruising, and he thinks that that animal might have been treated. The other thing that he has is he has a history of what animal this cow comes from, or what farm this cow comes from. And if he knows that farm has had a problem with residues in the past, he's much more likely to sample that cow than if it's from a farm that doesn't have a history of residues. So in general, the repeat violator, the violator list is not a good place to be. You want to make sure you stay off that list and certainly avoid every one of your animals getting sampled when they get sent to slaughter. We slaughter about 2.5 million cull dairy cows a year in this country. You can see the number of cull dairy cows that get tested and the rates of residue violations. About 1% of cull dairy cows are found to have violative residues. So about 4% of cull dairy cows get sampled. Okay? So it's not a very high percentage at this time. There's a lot of pressure on the FDA or from the FDA for the industry to increase the percentage of the cows we're sampling. To put this into perspective, European Union, they're testing 0.4% of cows that go to slaughter. So we're testing, even though 4% doesn't seem like that much, we're testing about 500% more than they do in Europe. And their rate of residue violations is about 2%. So of the ones they test, they find residues twice as often as we do in the United States. Data from cull dairy cows the last few years, again, you can see penicillin is the #1 residue violation. Again, the reason for that is most people are using doses at much higher than the label. Okay, nobody's using 15 mils of penicillin in a cow anymore. It's not an effective dose. People are using much higher doses. We need to have prolonged withdrawal times, and a lot of people don't because they're not working with a veterinarian. Banamine, flunixin, is the #2 most common meat residue in cull dairy cows for several different reasons. One is a lot of people are not giving it intravenously. If you give it intramuscularly or subcutaneously, the withdrawal time is prolonged. Ceftiofur, remember there's several different Ceftiofur products, Exceed, XNL, Naxel, they all have different withdrawal times, so make sure you keep your product straight that you're using. Sulfonamides, Albon, oral Albon is still a major problem in the dairy industry. Most common causes for residues: not giving the correct dose of the drug, failure to follow appropriate milk withdrawal guidelines, excuse me, no written treatment records kept, or you can't find the treatment records, or the guy that's milking didn't write down the treatment record and he doesn't know where they are. Poor animal identification, not using leg bands or neck bands, extra label or illegal drug use. So using a high dose of penicillin without extending the withdrawal time is a major cause of residue violations. Other causes, specifically in the dairy industry, accidentally milking a treated cow into the bulk tank is still a problem. Accidents happen, but this is a major reason that we have residues. Milking a cow that has been dry treated into the bulk tank, using a dry cow treatment instead of a lactating cow product by mistake is a major issue still. Not diverting the pipeline from the bulk tank before milking cows, not following proper withdrawal times, or using extra label treatment without extending your withdrawal times. Okay. I was asked to talk just a little bit about the milk sampling study that the FDA is doing. Most people that read hordes have at least heard about this, that there's a sampling study being done. There's no results yet. If you're looking for the data, I don't have any. They're not going to present any data until the study is done. But this was announced at the end of 2010. They spent most of 2011 haggling with the dairy industry about the methodology of this study. But the purpose is to determine whether farms that have a previous history of coal cow drug residue violations have higher rates of milk residues than farms that don't have a history of coal cow residue violations. Okay? So what happened is the FDA generated a list of dairies that have had residue problems in coal dairy cows. Then they're targeting what labs or what processing plants these farms send their milk to. The FDA is going in and purposely sampling milk from these herds over the course of a year, and then they're choosing random samples from farms that don't have a previous history of drug residue problems. These drugs are going to be, or these milk samples will be screened for 30 different antibiotics, which is pretty much every antibiotic you can use in the dairy industry, plus 5 to 10 that you can't use in the dairy industry. They're screening for flunixin, and they're screening for 2 other non-antibiotic drugs. Okay? All drug testing is going to be done by an independent lab, by a third-party lab. They're getting randomly numbered tubes, so they don't know, which is a repeat violator versus what is just a control, or I'm going to call it a healthy farm. Collection of these milk samples is still underway. It's going to go through the end of the year. And part of the agreement with the dairy industry is that no results will be disclosed until the study is done. So you ask the FDA what are they finding, they're not going to tell you anything. They wouldn't tell me anything last week when I called them for information. And that was the agreement, that nothing be discussed until the project's done. Okay? But if they find a whole bunch of, they're testing for a lot more antibiotics than we typically find. If they find that people are actually using some of these weird antibiotics, if they find that these farms that had previous residue violations have a lot higher percentage of problems than other farms, you can bet they're going to start sampling more often. Particularly, there will be more inspector-generated samples. So you want to stay off this list of repeat violators, because they're going to start looking at these herds to a much greater extent. If you're a herd that has never had a problem, is doing things the right way, they're still looking at you, but on a much lower level or much less frequently. Okay? So in conclusion, make sure you have a good relationship with your veterinarian. That's probably the most important thing you can do. Your veterinary client-patient relationship is critical. Education is critical, both the veterinarian educating the producer and the producer educating the employees. Maybe the veterinarian needs to have a training session to make sure everybody knows how to give an injection IV, knows how to administer a drug properly. I'm sure your veterinarian would be happy to set something like that up if you ask him to. Employees need to understand how to administer drugs. They need to make sure they know how to read treatment records. If you've got good treatment records in your parlor but nobody knows what they mean, the milkers don't know what they mean, it's going to be difficult for them to follow it very effectively. As dairy farms become larger, there's more and more employees involved. There's more and more opportunities for mistakes. Remember, these new analytical methods the government is using can detect very, very small concentrations of drugs in meat and milk. Okay? Your chances of slipping it through the system are getting less and less every year. Scrutiny of milk is at an all-time high, and it's going to continue to increase in the future. Everyone involved in the dairy industry needs to think of those two kids eating the hamburger and drinking the glass of milk on the first slide. Okay? It's very important that we maintain a very good perception. Residues are a significant public health concern. There was a survey about a year ago in New York of people's perception of animal agriculture in the dairy industry at the time. Actually, most people had more positive thoughts about it, thought better of it than poultry, swine, or even beef. And we need to do everything we can as an industry to make sure that stays that way. We have, in general, a very good public perception. Most people think milk is a very wholesome, good, nutritional product, and we don't need to have residue problems on the front page of the newspaper. So don't think about this as it's not that big a deal, but just the perception is a huge deal in terms of our industry. Okay? So they said 40 minutes, that's 45 minutes. I had a couple other slides, but questions? I'd be happy to answer any questions people have. How many are producers? How far away is your veterinarian? Yeah. Good. How about you, Anthony? That's what I thought you'd say. He's on the phone 10 states away, right? Okay, well, if there's no questions, thanks.
I do got a question.
Okay.
So you talked about these drug residues and these, how we have to have this perception, but then on the same side, people that are producing milk, for instance, like the organic guys, just beat the crap out of us. Why aren't us conventional people going after them and telling them to stop doing that? Because they're our biggest opponents.
I don't have a good answer for that. I mean, it would be, I've been to some organic dairies. I mean, I am somewhat resentful of the videos the organic industry puts out of mistreatment, on conventional farms, because I guarantee you I can make a similar to worse video of what the, two-quarter cows and lame cows on organic farms. It's not good for the industry to do that, but if the organic industry is somewhat attacking the conventional dairies, I think you're going to have to do something to stick up for yourself.
Somebody has to do something because they just keep their worst enemy in the whole deal.
Did you know that organic dairies have petitions and are allowed to use vanillin?
No, I did not.
They have. Throwing it out there.
I'm not against organic dairying at all. I am somewhat against the organic principle in this country that you can never use an antibiotic. I'm very much more in favor of the European approach where you can use it when you need it, but you double with the withdrawal time. I mean, I think, but it's a welfare issue. Cows get sick. There's lots of diseases I see that I know I can treat on an organic dairy, but I'm not allowed to use drugs. I would be for it if I could use drugs, but that animal has to have a very extended withdrawal time. But to say I can't treat that cow at all bothers me as a veterinarian.
As a veterinarian, wouldn't you say that would be against what you guys believe in?
In some cases it is. In some cases there's ways around it, in terms of healthy management, but I have definitely seen one of our state herds is now organic, and I mean they had a bunch of calves with pneumonia last year, and they said, well, what can we do besides use antibiotics? And I mean, most of them died. We could have saved most of those with antibiotics. So it does bother me. Well, that's getting away from responsible drug use. Thanks for coming.
Thank you, Dr. Smith, for your seminar on avoiding drug residues in the dairy industry. I'd like to ask everyone to fill out the evaluations and leave those in the back if you don't mind. Thanks very much.